Take your house, for example. If your house burns down, you need insurance. But in the meantime, you need to keep the weeds off your yard and mow the lawn and take care of your flower beds. I haven't heard anybody using their home insurance to do that. You don't use your car insurance to change your oil. You use it if you get in a bad wreck. So healthcare, kind of wonder whether it shouldn't work that way too, where if you get a major health problem where you need the services of a specialist and a high technology hospitalization and intervention, then yeah, you're going to need insurance because you need to be protected from the really high costs of healthcare. But primary care is, although it can be high tech, it's also high touch. And you don't need insurance for something that's relatively low cost up front. A low cost service that has a lot of value in terms of navigating the rest of the system and determining whether you need additional care. It doesn't make sense to be using your insurance for the lower cost things. If you really think about it, when we come to billing, whether it costs $40 or $50 to submit a bill to an insurance company with all of the infrastructure and paperwork and electronic records that need to be done before submitting the bill, well, it's the same for $50,000 knee replacement and the same for primary care. So it doesn't make sense for the provider to be using insurance, and maybe it doesn't make sense for the patient to be using insurance. But if you really have good primary care, you may never need to dip into that deductible and the high costs of